People who live near a plant using ethylene oxide appear to have higher levels of the carcinogen in their blood. That's according to an environmental project in Illinois backed by the CDC. No such surveys have been taken in Georgia near plants in Smyrna. In Covington, using ethylene oxide, 11 Alive's Doug Richards has been looking at the Illinois case and what it shows. Doug?
Well, Jeff, this is significant in Georgia because there are at least 5 plants here that use ethylene oxide, including one in Covington and another one, of course, just outside of Smyrna. Georgia's BD plant in Covington is among those plants using ethylene oxide to sterilize medical equipment. The chemical compound causes cancer, according to the EPA. There are 2 plants in Illinois operating now that also use ethylene oxide. And when scientists took blood samples from people living near those Illinois plants, they found higher levels of ethylene oxide among residents living close by.
We found that the group of people living closest to the plant, the group mean, the group average, was higher than the average for everyone else that volunteered.
Susan Buchanan of the University of Illinois says the survey doesn't say why people living near the 2 plants have higher levels of ethylene oxide. She says more testing would potentially answer that question. Georgia and Illinois have each had public outcries over how plants in their states have used and sometimes leaked ethylene oxide. The way the 2 states have handled it are strikingly different. You'll ask how, and you'll get your answer on 11 Alive News at 6.